Hello, welcome to Hermann's Resolution Reset series. I'm Michael Tsang. I'm a doctor of physical therapy and I'm a board certified orthopedic clinical specialist. Today, welcome to our stretching and mobility workshop, where we're going to talk about several aspects of stretching and mobility, also incorporating some strengthening as well as some cardio, and also talking about ways that we can relieve pain and pressure points or areas in the times that we are returning to work in the office. So thank you again for joining us today, and feel free to ask any questions in the chat. So first things we're going to talk about is stretching and mobility. So in terms of stretching, there's a difference between stretching and mobility. Stretching is where we focus on stretching the muscles themselves. The other aspect is mobility, where it's more focused on joint to joint. Now, it's important that we incorporate mobility exercises into our routine so that we can appropriately stretch the muscles that we need. So today we are going to cover some of those exercises right now. We'll focus on mobility. So first things first, we're going to focus on mobility of our spine. So that goes from our cervical, thoracic to lumbar region. So I'm going to demonstrate a couple things for us here. So in that in mind, what we're going to do now, for the sake of time, we're going to just do one set of 10 of each of these types of exercises, and feel free to do them together. With the stretches, we're just going to do one set of 30 seconds. However, when you're doing this on your own, feel free to do 2 sets of 10, or for a stretch, feel free to do 2 sets of 30 seconds. So first thing we're going to demonstrate, we're going to go onto our hands and knees. And these are called cat camels or cat cows. And we're going to do a set of 10 here, so feel free to go through it with me. So we're going to be on our hands and knees. And what we're going to be focusing on here, remember to breathe with all these exercises. So what we're going to do, we're going to arch our back as we bring our head down. And then as we bring our pelvis down, we're going to look up. So we'll do this 10 times. So notice how I'm feeling the stretch in each of these positions here. Good. So this is focusing on our spine flexion and extension mobility. And remember to breathe throughout the exercise. Good. And we'll do one more. Okay. So the next thing we're going to work on is our thoracic rotation mobility. So this, what we're going to do here, we're going to sit on our heels just a little bit. We're going to take one of our arms, we're going to reach it straight over and across. Feel the stretch through your mid-back. And as we come up, we're going to rotate the other way. So reach across, remember to breathe. And you can feel free to do this on both sides. Again, this is focusing on our thoracic rotation mobility. So these are called thread the needles. And as you're going through these, if you're experiencing any pain at all with doing these motions, or you're having any difficulty, feel free to lessen the range of motion or don't go as far into the stretch. Okay? All right, so those 2 exercises alone, feel free to do that on the other side as well. Now something we're focused on here is just a rock back into a child's pose position. So from here, you're gonna rock back. You're gonna hold for a little bit. We're gonna do 5 of these. And feel the stretch in your lower back. And only go as far as to where you feel the stretch and no pain. What you can do here is you can hold at the bottom for a little bit. And I'm going to add a couple variations to these last ones here where you can rock back. And if you're feeling a little stiffer along your left side, you can rotate the other direction to get a little bit deeper of a stretch. And then back up, rock back, and then you can rotate the other direction. And then we'll come on right back up. Okay? So those are some good exercises for working on our spine mobility. So the next series, what we're going to focus on is the difference between static stretches and dynamic stretches. So the difference between those two, a static stretch is where we hold our muscle in a lengthened position for a prolonged period of time, where we're just focusing on stretching that muscle itself. The difference with a dynamic stretch is that we are focusing on stretching and actively stretching, where we're incorporating the muscles and priming those muscles for activity. So there's evidence that does show that before physical activity, doing static stretching can actually decrease the muscle performance or muscle strength as produced immediately after stretching. So the best way to go if you are going to be doing physical activity is dynamic stretches. However, what I'm going to do is going to show a couple static stretches that are going to be good, more for the front of the hip and our hamstrings. So the very first exercise here, and I'm going to demonstrate first facing you and then once facing out to the side. So I'm in this half kneeling position. I'm trying to stretch the hip that is on with my knee on the floor. So I'm going to focus on keeping my hips and pelvis nice and level. So I'm gently squeezing through my core here. And what I'm doing is I'm staying nice and tall, and I'm going to lean forward. I'm leaning forward just to where I feel a good stretch through the front of my hip. This is one of the stretches that we can hold for 30 seconds. What you're doing here, again, we're gently squeezing through our core so we can truly stretch one of our hip flexor muscles in the front. So as we're holding there, now demonstrate this from the side. So we're in this position here. Keep our core, our pelvis tucked in. We're leaning forward. Feel this nice stretch in the front of the hip. And if it hurts the knee to kneel down, feel free to put a pillow underneath your knee. Okay? Another good static stretch we're going to do, I'm going to pull on the chair. Oops. So when we're from this position here, if you're at your work desk or something and you want to stretch out the back of your thighs or your hamstring muscles, you're going to stay nice and tall, and you're going to just lean forward. And notice how I'm not slouching my back. In order to effectively stretch the hamstring, we need to stabilize our pelvis. Lean forward, and you should feel a nice stretch in the back of your thigh. So again, you can hold here for 30 seconds, and then relax. So those are two static stretches for the front of our hips and the back of our thighs or the hamstrings. Now I'm going to demonstrate a series of dynamic stretches that we can do that are really good for priming your muscles and working on flexibility before physical activity. So this first one we're doing is focusing on our hamstrings again, but remember again, we're keeping our hips nice and level here. We're going to put one heel out and we're going to scoop. We'll put one foot out, scoop, and notice I'm keeping my back nice and flat, and you should feel the stretch in the back of your thighs. So keeping my back nice and straight as I lean forward. And we'll do one more. Good. The next thing we're going to do is we're working on stretching our inner thigh. So what we're going to do, we're going to step over like this. And I'm stretching this side, and I'm going to go to the other side. Feel the stretch of our muscles called our adductors, adductors. And you're going to step again. Over, feel the stretch in the inner thigh. Feel the stretch in the inner thigh. You can just go back and forth. And in doing this too, it's an active exercise for the other side too, just priming those muscles for physical activity. Next thing we're going to focus on is just more of our hip mobility itself from a joint perspective. So what we're doing, coming out and around, up and around, up and around. And notice how I'm walking forward with this. You can feel free to do this in place. I'm just demonstrating some techniques you can do to make it even a little bit more active. All right. So then our fourth one is called our world's greatest stretch, which is a good combination of all of these dynamic stretches together. So I'll demonstrate it once on this side here, and if it's too difficult to perform, feel free to modify it based on some of these other stretches we've done. So what we'll do here, you're taking a lunge forward, and I'm going to put my hand right here, take my elbow, touch it to the ground, reach up, and then back. And we'll do it on the other side too. We're going to lunge forward, bring my elbow down, and then reach up toward the ceiling. And this is a good dynamic stretch for all the muscles around the hips and the knees. Do it on this side here. Lean forward, bring the elbow down, reach up. We'll do one more on the other side. Then forward, reach down, elbow down, and out. Okay? So these are a combination of our mobility and our stretching exercises here. So now what we're going to talk about next is some strengthening. So there's three components of fitness, which is our stretching and flexibility, mobility, our strength, and our cardiovascular fitness. So strength is a really important piece to incorporate along with your stretching routine. A lot of times muscles become stiff or tight as a result of not having enough strength in our larger muscle groups that support our posture or support our physical activities. So we're going to cover a few exercises that you can do for your upper body and your lower body that are good general exercises, and we'll discuss some modifications as well. So I'm going to move some equipment here. So the very first exercise we're doing is squats. So there's several variations you can do with this. The beginner level is focusing on using a kitchen countertop or your desk. And what you're focusing on doing is just bending and back up. And notice how I'm not bringing my knees all the way forward here. I'm thinking about pushing my hips back, keeping my back neutral as I come back up. So come down and up. If that's too easy, we're going to turn the chair around, cross our hands, come up, and then down. So we'll do 5 of these. Good. And notice how I'm keeping my spine in a neutral alignment here, and I'm driving through my hips here. Okay? If that's easy, we don't need the chair. You can do regular squatting, or you can get a kettlebell or a dumbbell or anything else that can homemade that can be extra weight in the front. You can do squats just like this. Okay? So that's a good general exercise for our lower body and our core. The next thing that we have are bridges. So I'm going to go ahead and lay on the floor. So bridges are focusing on our posterior chain strength. So I'm focusing on my gluteals. And what I'm thinking about doing before I lift, put your arms at your side, squeeze your core. You're going to drive your hips up. And only go as high as to where you feel it working your butt. Notice how I'm not going excessively high where I'm feeling it in my back. Okay? So this is our level 1, focusing on our butt muscles. Okay? A way we can make this more difficult, we're going to drive up, you're going to kick one leg out, then you're going to kick the other leg out, and then down. And notice I'm trying to keep my hips nice and level the whole time. So I'm feeling this work on this left side, feeling this work on the right side, and down. And the more challenging exercise for that, you're going to be one leg up like this, and driving through your left hip. So let's do 5 of these. Good. And if this is too easy, you can put a weight in your hips here. You can drive through your hips in that way. Okay? Alrighty. So the next thing that we're gonna work on is our strength around our calves. So feel free to hold on to something. So here we're in 2 legs here. We're going to raise our heels all the way up and then down. Up, down. Let's do 5 of these for now. Good. And what we can do to make this harder, we can just use one leg where you're lifting one side and going up and down. So this is focusing on our gastrocnemius and our soleus strength, which is our calf muscles. And focus on height and good control. All right. Now we're going to talk about some other exercises you can do for your upper body. So we're going to get into this position here. So we're going to do a modified push-up. So you're going to be on your knees right here. All we're doing is pushing down and back up. And only go as far as to where you feel comfortable. And we're going to do 5. This is a good general exercise for our upper body. And if it's too hard to bend forward, what you can also do are some shoulder taps in this position. So I'm trying to push the ground away from me, and I'm just tapping my shoulders. I'm going to show it from the front here. Tap, tap. A way you can make this a little easier is by finding a chair or a sturdy kitchen table. From here, same thing, you're doing push-up and up. Push up. And focus on good control. And then the other variation are the shoulder taps. All right, good. So those are some good general strengthening exercises that we can work on to focus on incorporating strength as a whole for our body. So next, we're going to talk about posture. So let me grab a couple things here. Alrighty. So as most of you are returning to the office, a lot of the time we talk about having good posture. So what is good posture? So good posture is when your body is at the most balanced position, and your biggest focus on having good posture is having good movement. So there's not one good static position or posture that you can be in that can help decrease stiffness or pain. So the most important thing is that you keep moving and you get in and out of different positions just so that you're able to maintain that mobility and prevent muscles that are holding you in one position for too long from getting stiff. So with that in mind, your best posture is your next one. So it's important to keep on moving. However, we can also talk about some things that can at least put you in an advantageous position as you're working, whether you're sitting or standing, which we're going to talk about right now. So I'm going to bring some things onto the screen. And I'll bring some pillows here. So here's my modified work desk. And notice the most important thing is that we have good support and balance and throughout our entire body. So first we'll talk about sitting. So as we sit in a chair, we want to make sure that when we are sitting in the chair itself, the weight is evenly distributed through our pelvis, and our feet and our knees are about 90-90 in terms of the degrees. What you can do, because a lot of these chairs either sit back or they don't have enough support, so you can take a pillow, put it in the back here. If that's not enough support in through the back, you can take a towel roll like this, stuff it right here, so you have a good neutral position. Again, it's very easy for us as we have this positioned here. Let me put this a little bit lower. What we tend to get in a habit of is pushing the computer away from us, and we're hunched over in this position. So this forward head position and our rounded shoulders position can create a lot of tension and stiffness in through our upper shoulders and the back of our neck. So what we can do, make sure that we either move the laptop closer to us, and making sure that the screen is eye level. So with a lot of laptops, unfortunately, you'll have to sacrifice either one or the other. But what you can also start doing is using the laptop as a screen and getting a keyboard that's a separate attachment so that you can keep your eyes eye level with the screen. We're trying to keep our fingers and our shoulders in this neutral position down here. So those are the key things with sitting that can be helpful. Make sure you also have some good supportive armrests, as this might be a little bit low. The other thing to talk about is standing. So a good thing to do when we are standing, it's good to find a position where you can work whether you're sitting or standing. So if you do have a standing desk, it's good to alternate between the two and to continue to move frequently. So if you're going to be sitting in one position for a while or standing in one position for a while, the goal is every 30 minutes, find a time to move, whether even it's for a few minutes, just to do some exercises so that your body doesn't get stiff in one position. So standing desk here, what you want is to be able to shift your weight back and forth between different positions. The other thing we want is to have soft knees, so don't lock out your knees, just a small bend, think soft knees as you're shifting side to side. And what you can also do is have a little stool that you can put your foot on so that you can vary your position side to side. So now what we're going to talk about last here is some exercise you can do when you do get stiff from being in these prolonged positions of sitting or standing. So very first exercise, what we're going to do, if you have a band like this, a resistance band, these are called wing arms, or what we're trying to focus on is our rotator cuff muscles, our deep neck muscles in here, and the muscles between our shoulder blades. So what we're going to do here, you're holding this like this, you're going to tuck your chin in toward your Adam's apple, we're going to gently squeeze our shoulder blades together, we're going to rotate out, and then back. Rotate out, and back. Let's do this 5 times. Good. Second thing you can do is working on that spine mobility that we talked about. So bring this back in. So these are called chest butterflies, and I'll show them from 2 angles here. So you're going to grasp your hands behind your neck, and what you're going to do, you're going to look down, and then open your chest. Nice and easy. And all the way up. We're going to do this 5 times. Good. And then the other thing that we're going to work on is some ways that you can relieve any tension or tightness in through our upper shoulders or the back of our neck. So, if you have a tennis ball or a lacrosse ball, what you can do is use this to press along any areas that are stiff. So you can take your hand, you can rub on it, you can put it against the wall, putting the tennis ball in the back, and find somewhere that you can rub on. It's a good self-release technique for some stiff muscles. Now the other thing that we can do are some stretches for our upper shoulders, which is called our upper trapezius, or levator scapulae. So what we're going to do here, we're going to stand nice and tall, or you can sit, look down toward your pocket. You're going to bend forward. So you're looking toward your opposite pocket, and you're gently pulling down. So only pull as hard as where you feel a stretch, but no pain. And feel free to hold each of these positions for 30 seconds. And then you can do it the other side. I'm looking down toward my pocket, and I'm pulling straight down. Now you should feel a nice stretch in the back of your neck here. And good. The other thing you can do, sometimes these muscles on the sides of our neck get a little bit stiff. So what you can do here, you're gonna just feel where your collarbone is. You're gonna push down gently, and then you're just gonna look up toward the opposite direction. You should feel a nice stretch through the outside of our neck there. So remember, with all these stretches and these exercises, you gotta remember to breathe as you go through them. And try to get on the other side, find that collarbone, tilt up. Feel a nice stretching through there. And then back. So those are some good mobility exercises and stretches you can do when you're sitting in a prolonged position. Remember, the most important thing with posture is that good posture is good movement, and that your best posture is your next posture or position. So thank you for joining us today. Yeah, absolutely.
So the first question says, what if your hips up during the hip mobility stretch?
So this is a great question. Yeah, absolutely. The question was, what should you do if your hips are popping during the stretch? So there's a few reasons why your hips may be popping or snapping. So sometimes people feel the snap in the front of the hip. Sometimes people feel it on the outside. The most important thing when you do these things is that it's not painful. So anytime there's any discomfort or pain as you do it beyond the regular stretch or regular muscle soreness from physical activity, then don't perform it. Or focus on pushing forward just to where you feel a stretch and it's pain-free. So there's a lot of reasons that can be contributing to snapping hip or popping of the hips. Now, as long as it's not in pain, then you can push through the stretch a little bit and just focus on working on that mobility itself. So unless it is painful, then it could be multiple reasons why that can be a contributing factor to your snapping hips or popping hips, which maybe need to be evaluated in person with a healthcare professional.
Thank you. The next one is, what's the best way to relieve stiff hip joints?
Best way to release stiff hip joints. So we talked about early in the session some good static and some good dynamic stretches. So it's important that when we are doing them, we can usually the stiff points are the front of the hip and the back of the hip. So you can always look back to the video, which should be recorded, and a lot of the stretches that we did for our hamstrings and our hip flexors, those are some ways to relieve our stiff hips. With that in mind, though, the best way to relieve stiffness is to keep moving. So if you're sitting for a while and you're noticing your hips are getting stiff, that's a sign that you need to get moving and get out of that static position that you've been in.
Thank you. Some great questions more. What are some of the best home remedies to relieve muscle aches and pains after a workout?
Okay, so that's another great question. So remember, it is normal to have muscle soreness up to 48 hours after doing strength exercises. That means that's working on getting your muscles stronger and building strength. Now, ways you can work on recovery, because recovery is very important after you exercise, making sure you're drinking plenty of water, 8 to 12 cups a day, making sure you have a good nutritional diet, having a good colorful plate, and make sure you have some protein involved there to facilitate muscle growth, and especially making sure that you are sleeping appropriately, trying to get 7 to 8 hours a day. So what you can do to directly work on relieving the muscle itself is maybe using a foam roller to help roll out the muscle, or some of these mobility exercises we've done today.
I think this one came right before you showed the neck shoulder pain, but it was asking how can I relieve some neck shoulder pain?
Yes, so just to recap again, the best way to prevent stiffness from happening or tight muscles from happening in the first place is to build the strength around those muscle groups, as well as continue to change positions. So if you are feeling that stiffness, some of the techniques you can use, again, you can use a foam roller, you can use a tennis ball or lacrosse ball, or you can even use your own hands, just things that you can do to work on stretching those areas. Just remember, none of these stretches or exercise should be painful. They should only feel relief with the stretch.
Last one, I relate to this when I'm in my 30s, but what causes morning stiffness?
So morning stiffness, that's a great question. So morning stiffness can be multifactorial. Like we discussed earlier, usually when you're in a static position for too long, it's normal for stiffness to come about. So when we're sleeping, we aren't able to move around. So that's usually what happens with morning stiffness. Now there's certain conditions as we age that are contributing factors to morning stiffness. For example, arthritis. Those are things that can contribute to morning stiffness. But the best way to handle that is when you wake up in the morning, try some of these mobility exercises, get your body moving before you even get out of bed or on the edge of your bed, just to prime those muscles for physical activity for the rest of the day. So morning stiffness is normal. Alrighty, so that's great. Thank you for joining us today and have a great day.